Hello and welcome to Dear Doctor, the medical YouTube channel where we explore the latest trends and innovations in healthcare. Today we're going to talk about how robotics and nanomedicine are transforming diagnosis and treatment of various diseases, such as cancer, diabetes, and neurological disorders. Robotics is the science and technology of designing, building, and operating machines that can perform tasks that humans or animals can do or cannot do. Nanomedicine is the application of nanotechnology, which is the manipulation of matter at the atomic or molecular scale, to medicine, which is the science and practice of diagnosing, preventing, and treating diseases. Both robotics and nanomedicine have the potential to transform healthcare by enabling more precise, efficient, and personalized diagnosis and treatment of various diseases, especially those that are hard to detect or cure with conventional methods. Let's look at some of the examples of how these technologies are being used in different fields of medicine. Cancer is a group of diseases that involve abnormal cell growth that can invade or spread to other parts of the body. Cancer is one of the leading causes of death worldwide, and one of the most challenging diseases to diagnose and treat. Robotics can help in cancer diagnosis and treatment by providing minimally invasive surgery, targeted drug delivery, and imaging. For example, robotic surgery can remove tumors with greater precision and less damage to surrounding tissues than human surgeons. Robotic drug delivery can use micro or nanorobots to deliver drugs directly to the tumor site, avoiding side effects and increasing efficacy. Robotic imaging can use robots to scan the body and detect cancer cells or biomarkers with high sensitivity and specificity. Nanomedicine can help in cancer diagnosis and treatment by providing nanoscale devices, materials, and systems that can interact with cancer cells or tissues. For example, nanosensors can detect cancer cells or biomarkers in blood or urine samples with high accuracy and speed. Nanoparticles can deliver drugs, genes, or radiation to cancer cells, enhancing their uptake and killing them selectively. Nanomachines can manipulate or destroy cancer cells or tissues, such as by cutting, drilling, or heating. Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar levels. Diabetes can cause serious complications, such as heart disease, stroke, kidney failure, blindness, and amputation. Robotics can help in diabetes diagnosis and treatment by providing automated blood glucose monitoring, insulin delivery, and artificial pancreas. For example, robotic blood glucose monitoring can use wearable devices, such as smartwatches or patches, to measure blood sugar levels continuously and non-invasively. Robotic insulin delivery can use implantable devices, such as pumps or capsules, to deliver insulin automatically and precisely. Robotic artificial pancreas can use a closed-loop system that combines blood glucose monitoring and insulin delivery to mimic the function of a healthy pancreas. Nanomedicine can help in diabetes diagnosis and treatment by providing nanoscale sensors, carriers, and stimulators that can regulate blood sugar levels. For example, nanosensors can measure blood sugar levels with high sensitivity and specificity and transmit the data wirelessly to a device or a doctor. Nanocarriers can deliver insulin or other drugs to the target cells or organs, such as the liver or the muscle, and release them in response to blood sugar levels or external stimuli. Nanostimulators can stimulate the regeneration or differentiation of pancreatic cells, such as beta cells, that produce insulin. Neurological disorders are diseases that affect the brain, spinal cord, or nerves. They can cause various symptoms, such as pain, paralysis, seizures, memory loss, or mood changes. Neurological disorders can be caused by genetic factors, infections, injuries, or environmental factors. Robotics can help in neurological disorder diagnosis and treatment by providing neuroprosthetics, neurorehabilitation, and neuromodulation. For example, neuroprosthetics can use robotic devices, such as limbs, hands, or eyes, to replace or enhance the function of damaged or missing body parts. Neurorehabilitation can use robotic devices, such as exoskeletons, gloves, or games, to assist or train the recovery of motor or cognitive functions. Neuromodulation can use robotic devices, such as electrodes, coils, or implants, to stimulate or inhibit specific brain regions or circuits, affecting their activity or plasticity. Nanomedicine can help in neurological disorder diagnosis and treatment by providing nanoscale probes, agents, and interfaces that can interact with the nervous system. For example, nanoprobes can monitor or record the electrical or chemical signals of neurons or synapses, revealing their function or dysfunction. Nanoagents can deliver drugs, genes, or nanoparticles to the brain or the spinal cord, crossing the blood-brain barrier or the blood-spinal cord barrier, and targeting specific cells or regions. Nanointerfaces can connect or integrate with the nervous system, enabling bidirectional communication or control. As you can see, robotics and nanomedicine are transforming diagnosis and treatment of various diseases, such as cancer, diabetes, and neurological disorders. They offer many advantages, but also pose some challenges, such as safety, ethics, regulation, and cost. That's all for today's video. I hope you enjoyed it and learned something new. If you did, please give this video a thumbs up and share it with your friends. And if you have any questions or comments about robotics and nanomedicine for healthcare in 2023, please leave them below. We would love to hear from you. Thank you for watching, Dear Doctor. See you next time.